go ahead and get today's session started. My name is Asia Simpson. I am your health and wellness benefits consultant. I've been supporting your district, your benefits department, your bargaining units, oh, wow, maybe for the last 6-7 years. And so you may have seen my face before doing presentations on site, or if you've attended any of the virtual workshops or events, you've probably seen me. So welcome today. Today's session is the Medicare 101 session. Who we have here today, we have your benefits department, but who will be presenting today is Julie Brady from Kaiser Permanente. If you have attended any of these sessions in the past, you have seen Julie's lovely face presenting to you all of this wonderful information. I want to make sure that I let everyone know that today's session will be recorded. This session will go from 4 p.m. to 5 p.m. So if you find that you have technical issues or for whatever reason you have to drop off, or maybe you got on a little late, don't worry, you will be able to review this as well as the content that will be presented in today's session. Before we get started, a couple of quick housekeeping things. If you are in the question and answer mode, I'd like to ask if you could please make sure you put yourself on mute. What happens if you don't is sometimes background noise or conversations or people will come into the room, or we can hear that, and what that will do is that will interrupt the audio for the presenter. And I'm sure everyone wants to hear all of the amazing information that Julie has to share with you all today. So please check for me now at this point to make sure that you are set to mute. If you are not, I will periodically be checking, and I will go ahead and set you to mute myself just to make sure we don't run into any noise issues or background issues. Before I hand off to Julie, what I am going to go ahead and do is there are a few things that I would like to make sure that I share with you all. There are typically questions that you guys ask that don't necessarily have anything directly to do with the content that she will be presenting today. So I'm going to start off with that. And I think that will be a nice beginner before we segue into the content that I know you guys have all come here today to see. So what I'm going to first start off with doing, and I'll need a little bit of audience participation with maybe some thumbs up for those of you who are actually on video, have your video on. Could I get a thumbs up from anyone to let me know that you can see the slides that I have presented? Anybody give me a thumbs up? And just keep in mind, I can only see a few of you at a time. We've got quite a few people. Julie, if you could give me a thumbs up if you see it. Perfect, thank you. If you've ever presented with Zoom, you know that you can only see like the first 5 or 6 people once you're in presentation mode. So I thought about that after I said, give me a thumbs up. Today's workshop, Medicare 101, I went over the introductions with myself. I'll let Julie give a little bit more about herself if she chooses to, but I'd like to first start off with making sure that I make this mention. This is a recorded session and your questions are welcome, but 2 things I would suggest is to try to save them for the end, because I'll go ahead and stop recording once we get to the end. But also, if you do have a question that can't wait till the end, please refrain from sharing your specific information, because that's what we call your protected health information. And so your concerns, your questions, you will have the support that you need to get answers. So if it's something that's in depth that you need help with, you can feel free to reach out to me. You can send me a chat and say, hey, Asia, can we set some time aside? You can give me a call or you can shoot me an email. But we just don't want to have it on a recorded video. So just to keep that in mind. Other thing I'd like to mention, if you know anything about your benefits with MUSD, or you have reached out to your benefits department, you know that to qualify as a regular retiree for district contributions, you must have at least 15 years of service with the district and be at least 55 years of age. Now, I want to be clear, this is not a presentation on retirement benefits, but I think this is an important piece to make sure that I address, because sometimes we get these questions during this session. Now, if you do have follow-up questions regarding your benefits, please make sure, by all means, you reach out to the benefits department. They're awesome with providing that information. The other thing is, if once you retire, the district will actually reimburse medical insurance premiums until the end of the month, up until the age of 67. Now, the exact amount that will be reimbursed each year will be communicated to you by the district. Generally, they'll send out a letter for those who retire. Again, you won't see any of this until you actually retire, but this is just providing you with a bit of background information, just so you know. And if you are a teacher at the age of 67, well, actually, if at the age of 67 for everyone, district contributions stop once you get to the end of the month at the age of 67. Now, if you are a teacher and you are a part of the MTA trust, the trust will begin reimbursing medical premiums up to $500 once the district reimbursements stop. So again, I'll send this out to you all. We'll have this for reference, but this is just a quick point I want to point out to you. The other thing that I know you all will get confused about, because there's so many different ages floating around here, but I thought it was important to just distinguish for you right now so you don't get confused. 65 years of age, which that age benchmark is really going to be the bulk of what Julie is going to be talking about, like what things happen around that age. And that applies to, you must apply for Medicare, and medical plan choices change once you hit 65. Versus 67, that is related to your district benefits. The age of 67 is when district contributions stop. So that's what I want you to be clear on. That's what I don't want you to get confused about those two ages. And so hopefully that will provide you with a bit of clarity to kind of move forward with receiving all the information that we have for you today. Okay, so that is where my part ends. And Julie, I'm going to pass it over to you and let you pick up. And if you have questions, you guys, I'm going to be manning the chat box, okay?
All right, thank you. I'm going to just share my screen. So I need to apologize for my voice. It is a lot better than it was a couple of days ago, but I'm still struggling with, I guess, a spring cold. But I'm going to do my best to give you all the information that you need. So again, my name is Julie Brady. I am an Executive Retiree Solutions Manager with Kaiser Permanente. So I support a team of people at Kaiser who work on the CalPERS account. So I am basically known as a Medicare expert for our CalPERS employees and retirees. Of course, definitely with the Kaiser plan. And I do know quite a bit about all the other plans that CalPERS offers, because all of the health plans actually interact with each other and are very aware of each other's plans. So what I'm going to do today is I'm going to talk to you about Medicare, the basics of Medicare, when you become eligible, how you can enroll in Medicare, and how that Medicare can coordinate with your CalPERS coverage. So I'm going to get started. And I just wanted to remind everybody, if you can keep yourself on mute, at least until the end when we have our question and answer session. And then also for those of you who are on video, you don't need to be on video. You can feel free to turn off the video if you would like to. I'm going to stay on video just so that you can all see me, but don't feel that you need to be on video. So let's look at the basics of Medicare, and then I'm assuming everybody can see my screen. I believe everybody can see my. Okay, good. I got a thumbs up. Okay, awesome. So who can join Medicare? So we already looked at that age of 65. That is the age when the vast majority of us become eligible for Medicare. Now, and that's the focus of my presentation today, is when we become 65. There are some situations where you're eligible for Medicare sooner. If you're still working, though, actually, in any of these cases, if you're still working, you're not required to enroll in Medicare at any of these times until you retire. But for anybody who has gone through their 2-year waiting period, they're living with a disability, and they're eligible for Social Security disability, they will become eligible for Medicare after that 2-year waiting period, and they're actually automatically enrolled in Medicare. If you are diagnosed with end-stage renal disease or ESRD, and that requires a kidney transplant or kidney dialysis, you can enroll in Medicare upon your diagnosis. Same thing with amyotrophic lateral sclerosis. You can enroll in Medicare upon diagnosis. And then you do need to be a citizen or a permanent legal resident of the United States who's lived in the US for the last 5 years. So again, the focus is we're turning 65, or we are 65 or older, and we are retiring. So we're no longer getting health coverage through our employer. That's where we're going to move into Medicare. What is Medicare? Medicare is a federally funded health insurance program. It was established in 1965. It's administered by the Centers for Medicare and Medicaid Services, or CMS. So that is the federal entity that oversees the rules and regulations of Medicare and make sure that all of those regulations are administered, and all of the programs such as Kaiser and other plans, that they adhere to all of those regulations. Now, Medicare includes 4 parts. You have Part A, which is your hospital coverage, and Part B is your medical coverage. Together, those two are known as Original Medicare, because when Medicare first started, it only included Part A and B, thus Original Medicare or Traditional Medicare. Now, remember that Medicare is not full coverage. It is actually a co-insurance product with deductibles before Medicare kicks in, and then co-insurance, usually of 20% co-insurance on your part, with Medicare picking up the other 80%. That is why that there are other programs that help fill in the gaps that Medicare has. So one program that fills in the gaps of Medicare is the Part C, or the Medicare Advantage plan, and that's the far right box. Medicare Advantage plans include all of the services that are covered by Part A and B. And many of those Part C plans also include your Part D outpatient prescription drug coverage. Now, with CalPERS, all of the Medicare Advantage plans offered by CalPERS all include Part D. So if you enroll in one of the CalPERS Medicare Advantage plans, you're going to get all of your A, B, and your D services. Now, some of you are not going to have a Part C plan. You're going to be looking at an Medicare supplemental plan or a Medigap plan. Similar to Medicare Advantage, you get all of your A and B services through those Medicare supplemental plans. There are no deductibles, and there's usually a co-insurance, a low co-insurance, less than 20%. And in CalPERS case, those are those Anthem plans, PERS Platinum and PERS Gold. And in most cases, there's no co-insurance when you go seek services. And also with CalPERS, in the case of those Medicare supplemental plans, they include Part D prescription drug coverage as well. So the coverage you get through CalPERS would be full coverage. You would have your hospital, your medical, and your drug coverage. Now let's look in more detail at your Part A coverage. So that is your hospital coverage. So it's coverage for inpatient hospital care, skilled nursing, home health, and hospice care. Now, for most of us, there is no monthly premium for Part A. So Part A is considered an entitlement or an earned benefit. And you've actually been kind of prepaying for your monthly Part A premiums. So as you're working, each quarter that you work, or each 3 months that you work, you get 1 quarter towards a total of 40 quarters or 10 years that are required for you to have premium-free Part A coverage. So you would want to determine, am I going to be eligible for Social Security? If you're eligible for Social Security, that means that the work that you've been doing, you've also been contributing to Medicare. So if you've worked 10 years or 40 quarters, you've contributed to Medicare Part A, you're going to get that premium free. If you're not certain if you're going to be eligible for Social Security, you could check your pay stub. Sorry, I just wanted to remind everybody, if you could put yourselves on mute until later on in the question and answer session. Thank you. So Part A, if you're uncertain if you have been paying into Medicare, you can contact Social Security. They have all of the history of your work history in terms of the quarters and the years where you contributed towards either Social Security or Medicare. They would be able to tell you how many quarters you have, if you are fully eligible. Also, you could be eligible through a spouse or a former spouse if you have not remarried. So that's going to be really important to find out, because if you're not eligible for Part A, in many cases, you would just remain on a regular basic non-Medicare health plan. So moving on to Part B. So A was that hospital coverage. B is your outpatient coverage. So it is coverage for you when you go in and you get care, but you're not admitted to a facility. So it's your doctor's appointments, your specialists, it's lab work, radiology, durable medical equipment such as CPAP machines, dialysis, and some preventive services. So unlike Part A, you have not been prepaying for any Part B premiums. You will at some point need to enroll and pay a monthly Part B premium. If you are getting a Social Security check when you enroll in Part B, your Part B premium will be deducted from that Social Security check. Or if you're getting a Railroad Retirement Board check as well, we don't see a lot of situations where people are getting a Railroad Retirement Board check. If you're not getting Social Security or you're going to delay or defer Social Security, you'll be able to set up another payment method. You could pay by mail, by check, you could have it directly debited from your bank account, or you could go online to Social Security and pay your Part B premium that way. There is something called a late enrollment penalty, and that is a 10% penalty for each 12 months that you declined or deferred your enrollment into Part B. It's not a one-time penalty. It does continue throughout your enrollment in Part B. But the key thing to remember here is you are not impacted or affected by this late enrollment penalty if you are continuing to work and get your health coverage through an employer when that employer has 20 or more employees. So obviously, your school district gets your benefits through CalPERS. Obviously, the school district and CalPERS has more than 20 employees. So as long as you continue to work and you're getting your health coverage through the district, or you're also potentially covering your spouse through the district, you or that spouse can defer enrolling in Part B until you retire, you as the employee retire, and you will not have that late enrollment penalty. So that's a good thing to note, because on the next page, we talk about the Part B premiums themselves. So your Part B premiums are based on your adjusted gross income from your tax return from 2 years prior. So every year there's a 2-year look back. So right now we're in 2023. So you would take the tax return out from 2021 and take a look at your adjusted gross income and also how you're filing your taxes. So the base Part B premium is $164.90 for 2023. The people paying that are either singles with an adjusted gross income of $97,000 or less back in 2021, or a married couple filing jointly with an adjusted gross income of $194,000 or less. Or on the right-hand side there, if you're married, but you filed separately from your spouse and your adjusted gross income from 2021 is $97,000 or less. So if you were to take your tax return from 2021 and you find that you're above that amount for the 164.90, you would want to see where you fit in this chart. So let's take another example of a married couple filing jointly with an adjusted gross income of $250,000 in 2021. They would be in that left-hand chart in the third row, and their Part B premium would be $329.70. And again, that is per person and per month. So each year, the Part B premiums do change. They usually come out in the fall for the upcoming plan year. So this October, November, you will see that the Part B premiums are released for 2024. And when you look at the charts for 2024, you would go back and find your adjusted gross income and your tax returns from 2022. So every year there is a 2-year look back. Now the Part B premiums can change every year. And remember, your adjusted gross income could change each year as well. You're never going to make the exact same amount of money in a particular year. You might have a year where you make less. So you might find that your Part B premium goes down. You might have a year that you are selling a piece of property, taking more distributions from some type of retirement fund, and that might bump you up. So you will find that for a particular year, you would pay a higher Part B premium. And then in the following year, it could reset. So just remember every year, look at your Part B premium, and then it's going to be based on your adjusted gross income of 2 years prior. When the federal government comes out with the Part B premium, you will get a notification in the mail from Social Security. It will show what your Part B premium will be. It will show what your Social Security payments are if you're getting Social Security. And then you'll see what your net Social Security payment will be, net of a Part B premium. So it won't be something that's unknown to you. You will get that in the fall, shortly before the following calendar year. And you can always find this information on the Social Security website or the CMS or Medicare website. So let's look at enrolling in Medicare. We all have an initial enrollment period when we are first eligible for Medicare. Now, your initial enrollment period is 7 months. It starts 3 months before the month that you're eligible, and it goes through 3 months after. Most of us are eligible for Medicare on the first of the month of our 65th birthday. And so we would become eligible, or our enrollment period would start 3 months before and go through 3 months after. So let's take my example. My birthday is November 15th. So I'm going to be eligible for Medicare on November 1st. My initial enrollment period is 7 months. It begins August 1st and it would go through February. So there's that 7-month window, 3 months before the month I'm eligible through 3 months after. If I was born on the first of the month, and I see we have about 50 people on the call. So if any of you were born on the first of the month, you need to remember you will be eligible for Medicare on the first of the month prior. So if I was born on November 1st, I would be eligible for Medicare on October 1st, and my initial enrollment period would start 1 month sooner. It would go from July 1st to the end of January. Okay. So that's just a little something else to confuse you there. But most of us were born on a day that is not the first of the month. And so we can remember we're eligible for Medicare on the first of the month of our 65th birthday. Now you have this 7-month window. I really only want you to think about the 3 months leading up to the month that you're eligible. So for me, it's going to be that August, September, October. And really, I'm going to do what I need to do in August, just in case I lose my paperwork, something happens, whatever the case may be. The Social Security is involved, Medicare is involved, big entities. You want to make sure you start soon. So if you're already getting benefits through Social Security, you are automatically enrolled in Medicare. So you'll get your Medicare card in the mail, and it'll have your Part A and Part B effective date on your card, and you'll get your Medicare beneficiary number on the card as well. If you're not getting Social Security, you do need to take action. So the action you take will depend on your working status, right? The status of the employee or the person who is carrying the health insurance. If you are already retired at 65, many of you retire earlier at 55 or 60. So if you're already retired, when you're starting that initial enrollment period, it's very simple. You're going to enroll in Part A and Part B in those 3 months so that everything is effective the first of the month that you are eligible. Because Medicare will become primary towards any other coverage you have because you are no longer working. Same with the spouse. If you are retired, maybe you're not 65 yet, but you're covering a spouse and that spouse is turning 65. If you're covering them, they will need to enroll in Part A and B because you are retired and you're covering them. So the employment status is for the person who's carrying the health insurance. Now let's flip things over. So let's say you're going to work until age 70 and you are getting into this initial enrollment period at the time that you're turning 65. So you're turning 65, you're going to continue to work. You can enroll in Part A if it is premium free. but you do not need to enroll in Part B. Why is that? Because the coverage you have through CalPERS, through the school district, is primary as long as you continue to work. The other point to remember about this is, if you recall, you have to pay a Part B premium. So there's no need for you to pay a Part B premium until you actually need that, and you don't need it until you no longer have health coverage through CalPERS or some other employer with 20 or more employees. So let's take me as an example. I work for Kaiser. I carry the health benefits in my family. As long as I keep working, I will not enroll in Part B. I can enroll in Part A if it is at no cost to me. I would defer my Part B. My husband's actually older than me by 2 years. I carry the health insurance for my entire family. So as long as I keep working, even if he turns 65, because I'm covering him, he can defer his Part B. Then once I retire, because I'm holding the health insurance, if I retire and he is 65, he needs to enroll in Medicare, and he needs to pick a Medicare plan, in this case through Kaiser, because that Medicare will now be primary to any employer sponsored coverage. Okay, so always think about the coverage that are the working status of the person who's holding the benefit, so the employee.
So Julie,
Yes.
there was a question in the chat box about the enrollment period. If you could just kind of say again what you said about the 3 months before your 65th and the 3 months after, and specifically the one where you might get an extra month on the example you gave. Could you
Oh, yeah. Yes.
say that again?
Yes. Yeah. Okay. So um, you're eligible for Medicare, most of us. It's going to be the first of the month of our 65th birthday. So um, I'll give another example. My mother's birthday is March 10th, so she was eligible for Medicare on March 1st. I have and so then you take that March 1st, and then you have an 7-month window, 3 months before through 3 months after. So for March, you would go backwards: February, January, December. So that initial enrollment period would start December 1st, and then it would go 3 months after the month of March. So April, May, June. So it would go through June. Even a simpler way to remember this, because I don't want you to think about the 3 months after, and I don't want you to think about the month that you're eligible. I want you to think about the 3 months leading up to the month you become eligible, right? We want to do everything proactively prior to the date we're eligible. Now, I have a friend whose birthday is January 1st. So he's actually eligible for Medicare on December 1st. For some reason, that's how the federal government has set that one up. So for him, his eligibility period will start 3 months prior to December 1st. So November, October, September. So his eligibility period starts September 1st, and it would go 3 months after December. So that'd be January, February, March. So put the month of your birthday in the middle, and then count 3 months after, 3 months before and 3 months after. And then anybody who's got their birthday on the first of the month, you get to be eligible 1 month prior. Does that clear things up?
Let's see here. So, okay. So yes, so when does the elder spouse, so it will, and asking the question about the spouse piece of things when you were talking about that. So when does
Yep.
the elder spouse have to enroll in Part B? Is it when the primary person retires?
Exactly. So let's move on to this. Actually, I'm going to move over to here, to looking at a late enrollment into Part B. So, and let's take that example of you're retiring, you're not 65, but you have a spouse who's 65. So that spouse has what's called a special enrollment period into Medicare. That special enrollment period, technically it's 8 months, but I want you to forget the 8 months. I want you to think about 60 days. Social Security says that these two forms can be submitted to Social Security up to 60 days prior to the date you want the Part B to be effective, let's say for your spouse. So let's take, for example, you are going to be retiring this month. You're retiring in the month of May. I believe you have health coverage through June because you get an extra month. And as you correct me if I'm wrong on this, but they should have an extra month in June for employer-sponsored coverage. So they would get coverage as a retiree effective July 1st.
Vivian, can you confirm that? I think that's correct. That
Okay.
sounds correct.
Okay, good. We got a thumbs up.
Yeah.
Okay, so
Yeah,
July
got a thumbs
1st.
up. Okay,
July
perfect.
1st. So if you as the spouse, let's say you're 60, you're going to just stay on a basic CalPERS plan. But maybe if your spouse is 67 when you retire, you can start the process 60 days prior to July 1st. So that would be right now, you could start the process and you would have these two forms. You would have your spouse complete the forms using a July 1st date. The same thing for those of you who you're the retiree. Maybe you're the one you're retiring at age 67 and you're going to retire and you want your Part B to be effective July 1st. So you would complete the 40B, which opens up that special enrollment period for a late enrollment into Part B. And then the CMS L564 is something that your spouse completes. And then also your employer completes the bottom of it. Your employer is attesting that your spouse had coverage through you as you're the employee and your spouse as a covered dependent. Those two forms can get submitted, uploaded into the CMS. Actually, it's the Social Security website, or it could be faxed or mailed to your local Social Security office. So you can start this 60 days prior to the date you want that Part B to be effective. So you need to figure out what your retirement effective date is. When are you going to be getting retirement insurance as a retiree, not an employee? And then you can count back 60 days and start that process at that point. Because you don't want your Part B to start until you actually have to start paying for it. So that would be July 1st in that case, would be the date that you'll need to start paying for Part B.
One other thing, Victoria has a question, and Victoria, I think it's regarding what we're on now.
Yes, I'm sorry. I'm a little confused. My spouse is 3 years older than I as well, and I plan to retire either at 60 or 61. So I understand that he's covered completely on my insurance until I get to the age where the district no longer contributes for me. Yeah, I understand he has to roll at 65 for his own Medicare Part A, but does he need to also apply for Part B as long as do mine being 67? Because I thought I had full insurance until then.
Not if you're covering him and you're still an employee.
No, I don't plan on, well, I don't know. I plan on being a retiree at 61. So he won't be. So if I'm a retiree, aren't we covered with full insurance until I'm 67?
Yes, you are.
Yes. And so if that's the case, then when he turns 65, he will need to enroll in Part B if you're retired.
Oh,
So when you retire, you're going to be 61, correct?
yes, or 60.
How old will your spouse be?
He'll be 64.
Okay, so then when he turns, when he's in his initial enrollment period, he will need to enroll in Part A and B.
Oh, okay, even though the district is covering me up until 67?
I mean, even if the district is covering you, they're covering you for the CalPERS Medicare plan, but that doesn't include the Part B. The Part B is a separate federal requirement.
Hey, Victoria, it's Laura Simmons in the benefits department. Why don't you give me a call tomorrow at work, and I'll walk through it all with you, okay?
Okay, thank you.
You're welcome.
Okay, thank you. And we'll take more of these questions at the end too, because you'll see, some of the examples when we start looking at the CalPERS paperwork and the CalPERS process. So I want to move on to Part D. Part D is actually the simplest. part. It's your outpatient prescription drug coverage. If you're staying on CalPERS in retirement and into a Medicare retirement, you are going to get your Part D through whichever CalPERS Medicare plan you choose. So again, that CalPERS coverage in Medicare is full coverage. You'll get all of your A and B services and your Part D services. So you don't want to enroll anywhere else. If you're at CVS, Costco or something, and you see their Part D drug coverage, if you were to enroll in that, it would actually remove you from the coverage you have through CalPERS or any other Medicare coverage that you have. So just be very wary of any sort of communications, marketing, anything you get from anything outside of the Medicare coverage that you're in. There is something called a Part D late enrollment penalty, and that is a late enrollment penalty of 1% of the base Part D premium for each month that you did not have Part D for 63 days or more after your initial enrollment period. That's a lot of words and a lot of complications for something that probably won't impact you. Sometimes if you are changing Medicare plans, you will get something from the new plan asking you if you had credible drug coverage. You could safely know that any of the CalPERS plans that you're on as an active employee, an early retiree, or a Medicare retiree, they are all credible to Part D. So if you get any paperwork in the mail, you can always acknowledge and agree that yes, you had credible coverage, and go ahead and send that back to that health plan so that you are not assessed any type of late enrollment penalty.
Julie, I do want to
Yep.
make one mention because this is sometimes problematic. One thing I want to mention to you, when you retire, and if you have gone through all the proper channels to get enrolled in your CalPERS Medicare plan, what you're going to notice though, before you get ready to get enrolled, is you're going to get bombarded by 8 million pieces of marketing mail and all of that. Please don't enroll in those standalone plans, because if you do, it will mess up your coverage. So I hope I'm not jumping the gun, Julie, on that.
No.
You might have already planned to say that, but it has been problematic in the past, and I just want to make sure people do not do that.
Exactly. Yes. I really tell people you can safely ignore the things that come in the mail unless they're from the federal government, Social Security, Medicare, CalPERS, the school district, or the health plan that you're in. But beyond that, yes, do not sign up for an umbrella or a tote bag. Do not call away for information unless you're going to completely step away from the CalPERS plan, because if you enroll in something else, then you will get disenrolled from the CalPERS plan, and it's very difficult to get back into that plan. Yes. So yeah, you're going to get more mail, and I'm sure many of you are, around the age of 65 or have experienced it where you're bombarded with that mail. I know somebody kept every piece they got in like a mailbox or something, and it was just overflowing. So yes, good point.
Yes. Natalie, you had a question?
And you're on mute, Natalie. We need you to go off mute. We can't hear you, Natalie.
Let me see if I can help at all.
Oh, there we go.
I'm sorry
off mute.
about that.
Okay.
Yeah, I unmuted myself. Okay.
Okay.
I'm sorry about that. What happens to me if I decide to unenroll in the insurance and go on Medicare? Can I do that, or do I have to continue, since I'm still working, do I continue with my insurance?
That's right. If you're going to continue to work after 65, you can stay with the insurance that's offered through the district. You don't need to
But
be.
can I stop it and go on to Medicare?
You can stop it. You definitely want to talk with the district benefits in terms of what you would be walking away from, because if you do enroll in Medicare, you're going to need to pay that Part B premium.
Right, I understand that.
And then pick a Medicare plan. Yep.
Okay, all right, thank you.
Sure. All right, I want to finish up Part D. So there is one other piece, there's actually two other pieces to Part D. One is the Part D IRMA, the Income Related Monthly Adjustment Amount. So technically there's no premium that you're going to pay for your Part D. It is included in that CalPERS coverage. But some of you may find if you were deemed to be a higher income earner, you might get billed from Medicare a monthly income adjustment amount. So if you recall the Part B premiums, any of you that found yourself on the chart where you were paying the base Part B premium of $164.90, you will not have a Part D IRMA. You are considered to not be a higher income earner from the federal government. Thank you, federal government, I guess. However, as we move up the chart, I think my example I used was a married couple filing jointly with an adjusted gross income of $250,000. They're on that third row there. They're each going to be billed $31.50 per month for an adjustment to their Part D. So that is, it's per month and it's per member. If you're getting Social Security and it's enough to cover this as well, it would get taken out of your Social Security check. If not, you would need to set up a mechanism to pay this monthly IRMA, similar to how you might pay a Part B, your Part B premium. The Part D IRMA changes as well each year. It's actually been going down. So we've seen drug costs go down. So the Part D IRMA has gone down also. It will come out in the fall along with that Part B premium. If you are assessed a Part D IRMA, again, Medicare will let you know. They'll send you that statement where you'll see your Part B premium, your Part D IRMA, and then your Social Security net of any deductions. And then wrapping up Part D, it is the low income subsidy. So the low income subsidy is Medicare's extra help program for beneficiaries who might be of limited income and resources in retirement. So the LIS can provide extra help with Part D premiums and outpatient co-payments for beneficiaries who are enrolled in a Part D plan. So if you want to find out more or if you want help enrolling, you would contact your local Social Security or Medi-Cal office. They can walk you through the enrollment process. And then if you're eligible for the subsidy, it's actually passed to the Part D plan that you are enrolled in. And then that plan passes the subsidy on to you and to your employer, depending on the portion of premium that you're paying versus your employer. So I want to wrap up the Medicare part of all of this, and then we can move into the CalPERS piece. So first of all, you have Part A and B. That's called original Medicare. For most of us, Part A, we're going to get that with no additional monthly premium because we've worked 10 years or 40 quarters and we've paid Medicare taxes. If we're not certain if we're eligible for premium-free Part A, we're going to want to make a call to Social Security because that's the first piece in that puzzle. So if that's not fitting for you, call Social Security, find out if you're eligible or how many credits you have or quarters you have towards full coverage. You might be eligible through a spouse or a former spouse. Then if you know that you have Part A as that premium-free, then there's Part B. You do not need to enroll in Part B until you've stopped getting health insurance through your employer as an employee. So whether that means you've decided to stop getting coverage through the school district, even though you're continuing to work, you want to just go on to Medicare, or because you've decided to retire and you're not going to be an active employee, then you would enroll in Part B. So you'd have A and B, you'd have original Medicare. Some people just remain with original Medicare, but there are gaps. There's that coinsurance of 20%, and then there's a deductible. So you're going to pay a deductible before either A or B kind of kick in to cover you when you need care. That's why most people do not remain in original Medicare. People are looking for coverage to fill in the gaps, to fill in that deductible and the coinsurance, that 20% coinsurance. So for CalPERS and for out on the open market, there are Medicare Advantage plans and there are Medigap or Medicare supplemental plans. All of these plans fill in those gaps. So they fill in the deductible and they reduce or eliminate the coinsurance. On the Medicare Advantage plans, they turn those coinsurance into a copayment if there is a cost share. So for Kaiser and some of the other CalPERS plans in Medicare Advantage plans, the copayment is $10 for an office visit. Some of the Medicare Advantage plans at CalPERS, there's no copayment. You can look at all the plans that CalPERS offers, and you can compare and look at the copayments and the coverage. For the Medicare supplemental plans, those are those PERS plans, PERS Care, not PERS Care, that was 2 years ago, PERS Platinum and PERS Gold. They also do not have a deductible, and they close up that coinsurance to, in most cases, you're not going to have a coinsurance when you go to the doctor or seek services. So that's what's known as filling in those gaps of original Medicare. So I'm going to skip ahead here, and I want to look at the plans that are available. I'm going to skip past some of the Kaiser stuff for just a second here. I want to show you the plans that are available through CalPERS in 2023. So the plans are reviewed each year. The board votes on the benefits and the premiums and the plans in July. I don't foresee many change. I don't see any new plans coming in or leaving in 2023, in 2024. But here's what we have for 2023. There are a number of Medicare Advantage plans that are available to you based on where you live. And then there are the Medicare supplemental plans. So I'll go to the bottom first. That PERS Platinum plan is available nationwide, wherever you live, as a Medicare supplemental plan. If you're planning to move outside of the United States, you would enroll in the PERS Platinum, just the regular plan, not the Medicare supplemental plan. The PERS Gold Medicare supplemental plan is available across the state of California. Now, the Medicare Advantage plans, they're either PPOs or they're HMOs. So, you know, that's a choice for you. Many of the PPOs actually have no difference in copayments between in-network and out-of-network. They're sort of an open network as long as your provider accepts Medicare and is willing to bill the health insurer. You could go to any doctor, any hospital, et cetera. And that would be with that Anthem Medicare Preferred plan and the 2 United plans, the United Group and the United Edge plan. All those are nationwide, and you can see any in-network or out-of-network provider, you're going to pay the same copayment if there is a copayment. The other Medicare Advantage plans, really enrollment will be dependent on where you live. Some are available in parts of California, like the Blue Shield plan. The Sharp Direct plan is available in the San Diego area. Western Health Advantage is available in parts of California. The Kaiser Senior Advantage plan, I'll show you a slide in a second here of the various regions where we are available. And then we do have the Kaiser Senior Advantage Summit plan that started in 2023. That is our plan that has no copayments for office visits. And that is right now only available in our California region. Now, what you need to do when you are retiring is you need to look at the age of the people in your family, and that will determine the action that you will take. So if you're retiring, then you have to determine, is anybody eligible in my family for premium-free Part A, either due to age or some type of health condition. So that was the disability. If you're on Social Security and you're living with a disability and you're eligible for Medicare, if you have ESRD or if you have ALS or Lou Gehrig's disease and you're eligible for premium-free Part A, you need to enroll in Part B, and then you need to choose a CalPERS Medicare plan if you're going to stay with CalPERS. You also, if you're required to pay that Part D IRMA, you would have to pay that as well, that income-related monthly adjustment amount. Then you have to pick a plan that works for your family. Now, the way CalPERS does things, they call their plans for active employees and early retirees. They call those plans basic plans. Not everybody knows what that is, but essentially those are basic plans. So if you're under 65 or you're still working, you will be on a basic plan. If your entire family is eligible for Medicare and you're retired, your whole family would be on a Medicare plan. If somebody is eligible for just basic and somebody's eligible for just Medicare, you're in a combo plan. So there's a rate sheet that CalPERS presents each year. The school district probably has it somewhere where you can see which plans are available in your region based on the type of coverage you need, whether you need a basic plan because somebody's under 65 or not eligible for Medicare, or you need a combo plan because at least one person is eligible for Medicare and at least one person is eligible for basic, or your whole entire family is eligible for Medicare. So sometimes depending on where you live, you might have to change your plans. In 2023, they made some plan changes so that there would be an equivalent plan. So for example, Sharp, I know Sharp added a Medicare plan. Western Health has a Medicare plan. Another example of the Anthem plans. So if you're in the PERS Platinum plan, now as a basic employee, you can kind of go directly from a combo plan and then into a Medicare plan if needed. So you don't need to make any plan changes. If you want to, though, it is an opportunity for you to change plans. So you could do that. You would do all of that at retirement through CalPERS. I'm sure the district helps walk you through it the first time. If you are retiring and you're 65, so you can contact the district and work with them. If CalPERS sends you something called a certification of Medicare status form, we do want to make sure you complete that form. So I'm going to show this to you on the next page. A little bit hard to read. It's the form on the left-hand side. CalPERS gets a feed from CMS 8 times a year. So they are actually getting Medicare information about all of the members that they have enrolled in one of their health plans, not just a Medicare plan, but any health plan. So they may actually have your Medicare information before you send it to them. But if for some reason they can't get it and you're turning 65, they may send you this form and you need to complete the form. Now you're going to complete the form and either say, I have Medicare, here's my Medicare information, please put me into this particular Medicare plan. Or you're going to say to them, you're going to fill out the bottom part, which will say, I'm not enrolling in Medicare. I'm going to continue to work. I'm covered by a spouse, I'm not eligible for premium-free Part A. So whatever your situation is for your family, you will complete this form to the best of your ability and then send it back into CalPERS. So this just means there's information that they need from you that they haven't gotten yet, and they're asking you, so they're being proactive. So definitely complete this form and send it to them. If you don't get this form from them, you don't necessarily need to send this form back to them. However, if you want to be proactive, you can call up CalPERS and ask them for this form, and they'll send it to you, and then you can complete it. And then I'm showing you the HBD 30 just as a sample. When you're remaining with CalPERS for your health benefits in retirement, they will become essentially your HR or your benefits team. So you would be making any plan changes through CalPERS rather than through the district. So you could go into My CalPERS and make your plan changes. So my other couple slides here, I just wanted to go over the CalPERS website, but I think I want to stop and take some questions because I want to make sure we get through any questions that we have. And then I can talk a little bit about the website after we take a few questions.
I have a question.
Julie, there was a hand that's been raised for a while. It's
Okay.
Whoever. Ford, I'm
Yeah.
sorry.
Yes,
Okay.
thank you. Yes.
Sure.
Okay, so I had a question pertaining to the Medicare.
Okay.
You had mentioned that if you are an employee, the district, once you retire, they cover you to age 65. But if, 67.
Right.
But if you retire prior to 65 and you have a spouse who is 65, do they then need to go on to the Medicare, or can they continue with the coverage from the employee up to age 67.
I think there's a bit of confusion there, Julie, around the coverage, and so maybe we
Right.
can clarify that.
So there, okay, so, and just close your eyes, guys, because I don't know how to get back to this slide quickly. So I think there's two pieces to this. So one would be, what does the district cover for your spouse? And so that would be a question for the district. But as far as what they need to do, usually in any case, whether the district is going to cover your spouse or not, if you are retired, the Medicare would become primary. So your spouse would be responsible for enrolling in A if it's free, and then Part B. That still greatly reduces the cost of the health coverage because it changes the funding structure. So when somebody enrolls in Part B, then there is some subsidy that is coming from the federal government to reduce the cost of the health coverage for that person. So since you're retired, that person's Medicare would need to become primary. So they would have to be enrolled in Part B. Whether the district covers your spouse, that would be a question for the district.
Can I give a clarifying point here? Because I
Please.
answered a couple of questions in the chat box, and I think this may be a recurring question that people have. The first thing I want to say is that the coverage that you get through the district, it is through the CalPERS plan. So it is through like the CalPERS pool and all of the plans that you enroll in through CalPERS. So if you are an active employee and you have a spouse on your plan as an active employee, and then you go to retire, if you want to keep your spouse on your plan when you retire, you can do so. But when you retire, what you need to remember is that it is not that the district is going to cover you per se on one plan or another. It is a specific amount that they will reimburse you towards the cost of the premium for whichever plan you choose. So that amount changes each year. They will send out a letter and they'll say, this year we are, for retirees, we're reimbursing X amount. So let's just say in 1 year, the X amount happens to be, just pulling a number out of the air, $1,200. This year, we are reimbursing $1,200 for retirees, eligible retirees who are enrolled in CalPERS plan. And the plan that you choose that has yourself and your spouse on it happens to cost $1,400. Well, you can keep your spouse on that plan, but the district is only reimbursing up to $1,200. And so you would have to pay the remaining $200 difference in order to make sure they're on your plan. So this particular workshop isn't specifically focused on that, but I wanted to clarify that because we've gotten a couple of questions through the chat box, and some of the questions are coming through. So I don't want that to be a point of confusion. And I hope that explanation helped a little bit.
Yes.
Did that help at all?
It did help. Is
Okay.
that monthly though, that amount that they pay up until that age 67, the 1,200 you
Yes.
pulled out the sky?
Yes. And again, it won't be necessarily 1,200. The
Right. That's
benefit
just
department
for
sends
the
out the
example.
amount, but yes, that
Okay.
is correct. Mhm.
And then the next part of my question, if I retire before 65, once I am 65, will the district then help with my transitioning to Medicare? Or am I on my own?
So Laura, I don't know if you want to hop in here, but
Yeah,
I will provide resources.
you're kind of on your own, but we are here to help you if you need it. I talk to people all the time that call and they're like, I'm turning 65 in 3 months. What do I need to do? We're more than happy to answer those questions for you. But as to filling out the paperwork and all of that, we really can't help you. But we'll do as much as we can for you.
Okay, and then if you were 65 when you retired, then it automatically transitioned and you will help with that?
If you are 65 when you retire, then before you retire, you'd have to go sign up for Medicare, and you let them know you're retiring effective whatever date. And then when you retire, once your insurance is, because like Asia said earlier, you'll be covered for another month after you retire under the district's medical. Once that ends, then yes, they would transition you over to your insurance's version of a Medicare supplemental plan.
Okay, thank you.
So do remember that nothing is really automatic. So there's a couple things. I mean, if you are getting Social Security when you turn 65, you will automatically be enrolled in Medicare A and B. So that's something the federal government will do. And then if CalPERS gets that information through their regular feed, they will move you into a Medicare plan, but that's not always automatic. So remember, it's two parts, and in the order of Social Security first, to contact them to make sure you get enrolled in A and B. And then the next part is, once you know that you're enrolled in Medicare or you're going to get that future enrollment, then you can contact CalPERS to make sure you get enrolled into one of their Medicare plans.
Yeah, and we tell retirees that you know, once you get your Medicare information, make sure you contact CalPERS and let them know you have it.
Great.
Yeah, so we try and make sure that they know that they should do that.
And CalPERS will also assist with the Part C for the Advantage, Medicare Advantage plan as well.
No,
No, you don't.
But they, oh, sorry, I was just going to say, I mean, you can call them and tell them you want to.
But she doesn't need to do that.
No, you don't.
Yeah.
no, because if you go with Part C, CalPERS is going to drop you. Because you
Yeah,
can't
if you try to
have,
do it separately. If you try to do it separately.
yeah, if you try to do something, you can't have two Medicare supplemental plans.
Oh, I thought maybe I misunderstood. I thought Part C was the one that allows Part A, B, and D. So
Well, these are the Part C plans that are available through CalPERS right now. So if you're going to, if you want to enroll in one of these CalPERS plans, yes, you can call them, or you can fill out that certification of Medicare status form and let them know which one of these you want to enroll in. If you don't choose one, they will just choose a default for you. They'll let you know that there's a default plan for you if you don't choose one.
Okay,
So-
I think I misunderstood something because I thought C would have helped with the additional costs, the gaps.
It does, but there's Part C plans available through CalPERS, and then there are Medicare supplemental plans available through CalPERS. They both help with those gaps. That's why you don't stay with original Medicare. But if you want to get the money from the district until you're 67, you will need to pick one of the CalPERS Medicare Part C or Medicare supplemental plans.
Do you get what she's saying, or did that confuse you a little bit more? I would just say to you, when you get ready to hit 65, this is the simplest way to explain it. When you hit 65 and you now have to make a choice because you were previously in a regular basic plan because you were working and now you're retiring, you need to choose one of the plans that you see on the screen if you're going to remain in CalPERS. What we're saying is, don't get something in the mail and apply, through some
Yeah, I got that
plan.
part, that we
But
don't want to go outside of that.
all you would want to be concerned with is making sure you make a selection from one of these plan options that you see on the screen. And if you're not planning on retiring now, I always do a presentation that makes you all aware of what the current Medicare eligible plans are for that particular year that you want to consider choosing from.
Okay, so just to recap, I will take one of the Medicare Advantage, but I just need to make sure it's through CalPERS so that I don't mess up my Part A and B.
Yes, just stick, yes, because
Okay.
just stick with that, yes.
All right,
And many
thank you.
people just take the Medicare plan that they're in, like the, I don't know why I'm having problems with my words, but like the compatible plan. So Kaiser, for example, Kaiser, we have a basic plan and we have a Medicare plan. So many people in Kaiser just go to Kaiser.
Yes.
Many people in PERS Platinum just go to the PERS Platinum Medicare plan.
Yes. Yes.
There's only one plan we currently have that there is not a Medicare
That's correct.
Advantage plan, and that's Blue Shield Access Plus.
Yes.
Okay,
But there's
perfect.
a Shield Medicare PPO, but it's not the same thing. It's a PPO. But yes, to Laura's point, that is correct.
Usually they transfer you over to the United Healthcare one, but again, that's a PPO. So when you turn 65 though, that's a reason to change your insurance. Whether
Yep.
you're whether it's open enrollment or not. You can do that any time of the year because retiring is a, you know, life-changing event. And you can, if you decide you like, if you have Blue Shield Access Plus and you don't want one of those PPO plans, you can switch over to Kaiser and take their Kaiser Permanente, you know, Senior Advantage Medicare plan.
Julie, there was a couple of questions in the chat box I wanted to just read off to see if we can
Okay.
get those before we have to close out.
Sure.
So Virginia, you asked if there was another workshop for health insurance during retirement with the district. So that one's not necessarily for Julie. So we did one in March, a retirement planning workshop. There was one done for employees who were not a member of the trust, and then there was a workshop done for those who are a member of the trust. The ones for those who are not a member of the trust, that one is actually recorded, and I believe, Laura, correct me if I'm wrong.
It is on our website. Yes.
Yes.
Yeah, if you go to the benefits webpage, there's a on the right-hand side, it says previous workshops. Just click on that and the recording is in there.
Yes, as well as the resources.
Yeah.
If you are a member of the trust, they did not record the session, but they did do the slides. They put the slides on the MTA website, so you can check there.
Kim is asking about this one. This one will also be put on the benefits webpage under previous workshops, so you can watch this one again too.
This one's for you, Julie. Are these plans still available if you move out of the state or like into Texas, for example?
So there is a great tool on the CalPERS website. Actually, let me just get to that slide. So, and I keep messing up. I can't bring my,
I think if you share, if you don't share.
Here we go. I'm good.
Yeah.
I just went to I closed my notes. Okay. So if you go to this search by zip, health plan search by zip tool on the CalPERS website, or even in the Google search box at the top of their website, the CalPERS website, if you typed in zip and hit enter, it will bring you to a tool where you can type in the zip code of maybe you're thinking about moving somewhere, you've got a relative that you're going to spend some long time with, and you'll see all the plans that are available in that particular area. So for Texas, it would be PERS Platinum is available nationwide. The 2 United Medicare Advantage plans are available nationwide. And I believe it's the Blue, I think the Blue Shield plan is the other one that's available nationwide. But the best thing to do is to go onto the CalPERS website, use that zip code tool, and see any plans that are displayed. So for example, if you're hoping Kaiser suddenly moved into Texas, we haven't, you won't see CalPERS or Kaiser, so you won't be able to enroll in a plan. You have to pick one of the plans that is displayed when you put that zip code in.
I'm just trying to see if I missed any questions. I think we may have caught them.
Okay.
No, I'm trying to type one in right now, or should I just ask it?
Sure, go ahead and ask.
Go ahead and just ask it.
Okay, so there's a year difference between my husband and I, so he's turning 65 next year. And so I'm changing his insurance to a Medicare.
Are you still
Yeah.
working?
No, I'm retired. He's doing his job and
Okay.
everything's on my insurance.
So if you cover him
Yes.
and you are retired, then
Yes.
yes, when he turns 65, he will need to enroll in A, if it's free, premium free, and then Part B. Yes.
On what I see in front of us, one of those things, because it's, of course, Blue Shield Access Plus. So
you both have to change.
We'll both have to change. Okay,
Yes.
Thanks, Laura. Hi, how are you doing, Laura?
I'm good, thank you.
Good. Okay, so good to know. Thanks.
Okay, good.
So question is, I was trying to answer this by typing it, but it might be better to explain it. Does the 3 months before and 3 months after refer later to parts C at 67? Well, 67 does not apply to Medicare. If you'll recall, 67 applies only to the time frame for which the district stops providing reimbursements towards the cost of your insurance premium. But age 65, Julie, if you want to reiterate enrolling in Medicare at age 65, 3, 4, and after.
Okay, yeah, so I think you're talking about the initial enrollment periods. Everybody close your eyes because I haven't figured out how to go quickly through these slides. So everybody has an initial enrollment period. It really doesn't matter whether you're working or not. It's 7 months long. It starts 3 months before the month that you become eligible. It goes through 3 months after. Ignore all that. I always like to say, just think about the 3 months before. So when you're turning 65, think of 3 months before you turn 65. And then if you're going to be retiring after 65, then I like to say, think of 2 months before. So if you're going to enroll in Part B later, so you're going to retire at age 67, you're retiring, then 60 days or 2 months prior to the month you're going to want to start your Part B. That's when you would apply. And then that initial enrollment period, so the first time you're eligible, it's 3 months before.
Okay. We're going to take one last question before we have to close out because I want to be respectful of Julie's time. We're a little bit over. And I see that you've had your hand up for a little while. And that will be the last question that we have. Everyone else, we can definitely take questions offline. You're welcome to reach out to me directly and I can answer any questions. And if I don't have the answer, I can reach out to Julie.
That's right. That's right.
Are you leaving, this is Anne. So are you going to be leaving your information for us to be able to access?
Myself, are you referring to me?
Yes, I am.
Yes, you can also look at the flyer that was sent out for this workshop and my contact information is on there.
Perfect. So my question is,